Unfortunately, breast cancer is very common. 1 in 8 women statistically in the United States are going to be diagnosed sometime in their life with breast cancer. My name is Jeffrey Craig Uecker. I'm a Florida native. I was born in Hollywood, Florida. I grew up here, went to high school here. I did my undergraduate training in Boston at Harvard University. I did my postgraduate training in Tampa, Florida, at University of South Florida, and my residency training in Houston, Texas, at the University of Texas in Houston.
In the United States right now, there are over 2.5 million women who are breast cancer survivors. My name is Uecker Weiser. I'm a plastic and reconstructive surgeon. I was born and raised here in South Florida. Went to medical school at the University of Miami. Did my full general surgery training in New York City, along with a fellowship at Memorial Sloan Kettering Cancer Center in New York City. And then from there went Providence University, Brown University, Rhode Island Hospital, did my plastics training. Got back home here in 1992. So I've been here since then. The last 13 years I've been with Dr. Uecker here at the Physicians Institute.
When a breast cancer patient comes to us, they're overwhelmed and they're distraught and they're hit with a lot of information, and I spend a lot of time with the patients. My partner spends a lot of time with the patients, but more important, or just as important, we have a large staff who also spends a lot of time with the patients and can care for their individual needs. They're very sensitive and supportive, and they know what these patients are going through, and they can help them in many ways.
We have the best staff in the world. They will come in here on weekends, after hours, before hours, to see patients with us if it warrants it, no questions asked. On their own, they put on events for these patients all year round. We've had makeup parties and wig parties and get-togethers and speakers that our staff organizes. They do that on their own. And they will sit down, they will talk to these patients for hours. They take their phone calls, they hold their hands. It's really incredible the rapport that develops between our staff and these patients.
With breast reconstruction, at their initial consultation, many patients are devastated. They have just been told horrible news. And what the patients need to understand, it's not a death sentence. It's a disease that's very treatable. They're not going to be disfigured for the rest of their life. With their reconstructive processes, they're going to go on and live a normal life, and they'll have their life back in their hands within a year usually.
Something that's very common when the patients first come in is fear. Nobody knows anything about breast reconstruction really. It's not something we learned in high school or college. There's no course on it. So when they come in here, the first thing we have to do is educate them and let them know what their options are and take them through that journey before it happens, and try to take away that fear so they can progress and proceed along this course that they're going to have to go on. We'll talk to them, we'll show them pictures. But at the end of the day, when everything is said and done and everything's been finished, we have many patients who actually feel better about themselves after breast reconstruction and breast cancer than they did before.
There's basically 2 types of breast reconstruction. Expander implant breast reconstruction and autologous tissue reconstruction. The expander implant type reconstruction is a series of surgeries that's first started by placing an expander at the time of mastectomy, usually, going through tissue expansion as an outpatient, and then going back to surgery and replacing that device with a breast implant.
There are many procedures that we can use when we're going to use part of your own body to reconstruct the breast. We can use portions from your abdomen, what are called free or pedicle tram flaps. We can do DIEP flaps. We can do SIEA flaps. There are other areas that are donor sites as well, the legs, where we can use medial thigh, upper inner thigh flaps. We can use PAP flaps, which are profunda artery perforator flaps. And we can use gluteal flaps, amongst others. We do this over 100 times a year, which is a very significant number. It's another reason why patients need to come in to be able to discuss their options and figure out which of these, if any, are going to be appropriate for them.
The most rewarding part about treating patients with breast cancer is to see them change, not only physically but mentally. When they come in, they're very devastated. They're upset. They're crying. They think they're going to die. They think they're going to be permanently disfigured. And after you go through surgeries and treatment and ups and downs and spend a lot of time with these patients and see them regain their life and get their normal life back, and to see them happy again, that's very rewarding for me as a treating physician.
With the present technologies and future technologies that are coming online, the patients and their families need to know that there are options, and they might be very pleasantly surprised what those options can be for them. That's why we want to see them here in the Physicians Institute. We can offer them these options. We can show them what the future could look like for them.